Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about a success story, and you know I love my success stories because they're awesome. We have a patient who had an esotropia, and they still do have it, but it's significantly less. I'm going to tell you about that in a minute. Now, before we get into that, I want to talk to you about how you can connect with our office. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you'll have two choices. You can either schedule a consultation directly with me, or you can fill out a questionnaire and get some feedback and preliminary information about your vision. Now, let's tell you about this patient who has an esotropia. It did measure a what's called 30 prism diopter, which is a fairly good amount of an eye turn. So it would be pretty noticeable to most people. And I'm going to show you a picture. This is not the child, okay? This is a previous patient of ours who gave us permission to utilize this, but this is a case of esotropia. You can tell that this eye is turning in right here. Here he is as we started working with him, and here he is as the end result with aligned eyes and no esotropia. Now, what did we do with this, and how on earth did we get this patient from a 30 esotropia down to what right now is approximately a 12 esotropia? When we get into the range of like half of that's decreasing and close to 10 and under as far as the misalignment of the eye, it's really not quite as noticeable by most people. In fact, a lot of doctors even would miss a 12 esotropia or 12 exotropia. So when it gets down into this range, it's considered to be a bit more cosmetic. But we're not going to stop here. Our goal is to get this patient to be aligned, and so that there's no esotropia and both eyes are completely aligned straight and looking at the same target at the same time. And again, how did we do this? Well, we utilized two phases in our program. The first phase is Syntonics, where we use a bunch of different filters of varying colors and specific ones that will trigger the muscles of the eye to get the brain to relax the muscle and to not cross it in quite as much. And then in the second half of therapy, which is called phase 2, it's more hands-on, where the patient is still using Syntonics, but now they're meeting with a therapist, and the therapist is prescribing activities for them to work on for them to achieve better binocularity. Now, if you yourself have esotropia, maybe your child does, or maybe it's a spouse or somebody that you know, then you might want to dig into a little bit more about how this can be treated and corrected without surgical means. So you can go to our website at visionforlifeworks.com. Certainly, if you're not local, that's the best thing to do. Go there and either choose to schedule a consultation with us, or you can fill out a questionnaire again and get a little bit of feedback. Now, if you are local, the direct route is just pick up the phone and give us a call at 618-288-1489. And if you like this video, obviously hit that like button. Make sure you're subscribed to our channel so you get all notifications for all the videos that we put out. And as I always say, if you feel like this could be benefiting someone else, please pass this video on. Thank you.